Hey folks, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you from our Hazleton location. That's Hazleton Eye Specialists on the Beltway in Hazleton. Our address is 281 Airport Road. Our phone number, 570-453-2020. You can catch us on the web, www.drkislan.com. And for those watching in our Pocono location in the Stroudsburg area, that's Stroudsburg Eye Specialists, 570-421-3342. We're on 9th Street in Stroudsburg, and you can catch us on Facebook also. Today I'm joined by Dr. Deom, our new associate, our new doctor at the practice, and also Mark Kesock, a patient of ours here at the practice. So Dr. Deom, Mark, thanks for joining us. We're going to talk today a little bit about a condition called keratoconus, and I'm going to have Dr. Deom explain in a couple minutes what keratoconus is, but maybe Mark, maybe you can tell us a little bit of your story about your vision and when you were diagnosed with keratoconus and really how your vision's been over the years.
Okay. Keratoconus for me, it really took off back in 1986. At first I noticed that for some reason I covered one eye and my right eye was the only one open, and I was looking at a tree. And the leaves, I couldn't see the leaves at all on it. It was just one big blur. And with my other eye, I could see them clearly.
How old were you at that point?
30.
Okay.
And so I went back to the doctor, and he sent me to cornea specialists. The Wills Eye Hospital I went to first, and then I went to the Hershey Medical Center and PCO. They sort of helped me a little bit. They gave me CSI lenses. They're a firmer lens, and that helped for a little while.
Okay. But your vision in that eye was just poor, right?
Yeah.
And so Dr. Deom, tell the folks out there a little bit, what is keratoconus?
So it's, thanks again for having me, and Mark, thank you so much for coming. It's been a pleasure getting to know you and continuing to get to know you. And so keratoconus is a condition that is typically diagnosed in the 2nd to 3rd decade of life, so it's not uncommon that it is found in your 30s. And what it is a progressive bulging and thinning of the cornea. And the cornea, as we know, is the front surface of the eye that is responsible for bending light as it comes into the back of the eye, or the retina. And so what happens is, for many individuals, what they'll notice is that there is a blurriness to their vision that cannot be corrected by glasses or conventional contact lenses. And you know, many people are studying right now what is the cause of keratoconus and what is potential ways in which we can stop this from occurring or getting worse. And unfortunately, there still really is no cure, so to speak, and there is no hard and fast reason on why we think these people have it. So there is possibly a genetic component. We think that there may be some allergy issue, and maybe people with really bad allergies rub their eyes, and then they have a predisposition for that repetitive eye rubbing to have caused some sort of bulging of the eye and some thinning of the cornea itself. And so what these people end up having is just a vision that cannot be corrected by glasses or contacts. And so did you have glasses or contacts through the time before when you were diagnosed? Like, what did they tell you at Wills Eye or some of these large medical centers?
At the Wills Eye Hospital, they just I was working in a glass factory at the time, and the light would bother my eyes there. And their diagnosis was that I had glass blower's cataract. And the doctor there that fitted me with contact lenses, he was supposed to be a specialist, and they were the worst lenses I ever had.
So, and you know, maybe, you know, something occurred there, who knows, but really, you know, thankfully there has been just tremendous innovation in the world of contact lenses, and so thankfully, you know, that is one of the things that I'm passionate about, really passionate about, and so that's where, you know, scleral contact lenses kind of comes into the realm of things. And so maybe you can tell us a little bit about what your knowledge was about scleral lenses, and then how you came to find us, and what your experience has been so far in comparison to what you've had on.
Well, the scleral lenses, I read about them a lot on the National Keratoconus Foundation. They have a website, and I knew about them from there. And how I got to find you is I had an eye infection. My eyes swelled up, and then from reading in the paper, I just saw that you were brought into the practice here, and I saw that you fitted scleral lenses. So when I called for my appointment here, I asked the girl if she'd get me in with you, and she did.
Good.
And it's been nothing but good news since then.
So up until this point, you know, you said you were at Wills and then Hershey and even PCO. Had they tried scleral lenses before at any point?
No, back at that time they didn't have them.
They didn't have them. Okay. So, Dr. Deom, the evolution of scleral lenses has really been able to help someone like Mark.
Right.
So explain a little bit about how these lenses work.
Yeah, so scleral contact lenses are different than regular contact lenses in one main feature, and that is their size. They're quite large in comparison to regular contact lenses. And so I have an eyeball here, and this is, you know, kind of, this eye needs an antibiotic because it's obviously infected. There's a lot of red around it if you're not able to see that at home. But the cornea of the eye is the part that is over the colored part of the eye, or the iris, okay? What happens is with a scleral contact lens, it's a large diameter lens, and it simply goes over the irregularly shaped cornea and provides a prosthetic cornea for the patient. Two things are really fantastic about this. First of all, it's very stable on the eye. It doesn't move around and touch the cornea, because the cornea is highly innervated, it has lots of nerves, and it's very sensitive. So if you touch it, it can be very painful. And so before these lenses, there were small, hard lenses that were very painful. You had those before?
Yes.
Can you tell us what that experience was like?
They're terrible.
Yeah.
Could you see out of them at all?
It doesn't correct your vision that well. It makes it passable, like 20/40 or so, whatever the norm. It's close to that, but it's constant pressure on your cornea, scratching all day. You can't wait until you get home to take them out. Whereas the scleral lens, it must be the water that you fill them up with when you put them on. They're comfortable all day long.
Yeah, so what happens is you fill up the lens with solution. This isn't an actual lens, so you don't put this whole thing on your eye. It's just it's a little bit of an exaggeration to show you at home, but you fill it up with solution, and then you place it on the eye, and that solution, you know, keeps the eye comfortable throughout the day. And so that's a big, you know, the change in what a scleral lens is. But another thing that's really important is the type of lens that we use. We use a very high quality lens called the custom stable lens. Produced by a small company out of Oregon called Valley Contacts, and you know, really the way in which the contact lenses are designed is just spectacular. And so we're able to put a diagnostic lens on somebody's eye, and really change the most minute things to the lens because of how the lenses are produced and cut. They have very fine precision lasers that help cut the lens. And so really we're able to fit all size eyes with all types of conditions and really get to a level of vision that is not achievable through any other means. These people are not candidates for laser vision correction, and even taking the lens out of their eye, putting a new lens in, like cataract surgery, would not correct their vision. So really, this is the only way to help these people.
And these custom stable lenses, I think we're the only office in the area that has these lenses.
That's right, yeah, so we are the only office in the area that has the custom stable brand and more broadly scleral contact lenses. And so you know, we're very proud to be that. And you know, what I always tell my patients is that this is one of those things that is a journey, okay? We put the lens on, and in Mark's case, it was kind of like a miracle. You were kind of tearing up almost when we first put them on, and it was like seeing the world for the first time. And many patients have that feeling, but it's not always that easy. You know, sometimes it's a process, and we got to change some things in the curves and all that kind of stuff. But we get there. And so, can you tell us real quick what it was like when we first put them on?
No, it was like the difference of night and day. It was like coming out of the fog.
It's great.
And that was just on the first time Dr. Deom put them on?
Yes, yeah.
Were they hard to get used to?
No, they weren't hard to get used to at all. They're comfortable right from the start. The hardest part about them is to learn how to put them in. They're a little bit tricky to put in at first.
Okay.
Right.
Yeah, so that's a great story. What I want to do, folks, is we're going to take a quick break here, and we're going to come back and we're going to talk to Mark a little bit more about keratoconus and scleral lenses. So you're watching Eyecare today, and we'll be right back. Welcome back, folks. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and just to remind everybody, we're coming to you from our Hazleton location. That's 281 Airport Road on the Beltway in Hazleton. Our phone number, if there's ever any questions, comments, suggestions for shows, questions you want answered, feel free to give us a call, 570-453-2020. Our website, www.drkislan.com. And for those folks working and watching in the Stroudsburg area, Stroudsburg Eye Specialists, 570-421-3342, and we're 852 North 9th Street there in Stroudsburg, and make sure to catch us on Facebook also. So to remind you, in our last segment, we were talking to Dr. Deom and Mark about a condition called keratoconus and some treatments that are out for keratoconus. Some treatments can be successful for patients, some may not be, but a new treatment called scleral lenses is something that can be very successful. So again, Dr. Deom, thanks for joining us, and Mark, again, thanks for joining us today and telling us your story. Just to maybe remind the viewers, or if someone's just coming on watching halfway through, tell me a little bit again about how you found your vision was bad and how long ago that was, and kind of your story up to this point.
Well, it was right after I got new contact lenses. I came home and I was looking out the window, and for some reason one eye was covered, and my right eye, the one with keratoconus real bad, I was looking at a tree and I couldn't see the leaves on the tree. It was just one big blur.
And then you had said that you had been to Will's Eye in Philly, you were at Hershey Medical Center, you were at some other facilities, and just never were able to help you. And did you find your vision actually getting worse in that eye as time was going on? Yes. Was that scary?
Yes, it was, yeah. I thought I was going to go blind. Even when I looked at later on, when I looked at people and all, they called ghost images. Like I'd see like 3 people there standing looking at me. Yeah.
And how was it driving? Like night driving? How was your night driving?
Bad. I wouldn't even drive at all in the night. It was that bad.
So you actually stopped driving at night because of your vision.
Yeah.
And that, you know, for the folks out there watching, that can really affect people. You know, you have to maybe quit work early or not do the things that you used to doing because you're afraid because of your vision. And then, so you gave us the story before that you ended up having a little bit of an eye infection, and you called up the office and you saw that Dr. Deom had joined the practice, and he fits these things called scleral lenses. So you asked for an appointment, and not only did he fix your eye infection, but then he probably talked to you about the scleral lenses, right?
Right.
And what exactly did he tell you? Do you remember?
He said he could probably help me see a lot better, that they'd clear my vision up, the keratoconus.
Okay. So Dr. Deom, take us through now that fitting process with Mark. We talked that you have these great lenses, these custom stable lenses, and you have the ability to actually try them on the patient right when they're here.
Yeah, you know, it's a really fun experience, you know, for me as the provider doing it for you. I just cannot wait to see, because many times these individuals, Mark was a great example, have 2200 vision in those eyes, okay? 2200 vision is not being able to see from here on, okay? And so really, you know, you have the opportunity to just totally change somebody's life within a second. And so many times people are a little apprehensive. It's a large diameter contact lens. It is hard, but I tell them, you know, let me take this opportunity, 10 minutes, to put this lens on your eye. I will do it. I promise you it's much more comfortable than any other lens that you've had before, because many times these people have been to countless doctors, tried countless different lenses on their eye and glasses, and are really very frustrated with their vision and don't believe much that we have to say. But I almost beg some of them to give me the opportunity to see if I can help them. And I say, look, if it doesn't help and it doesn't feel comfortable, or if you know, it's not what I'm telling you it is, then no harm done. It's like we've never done it. And I say that because I'm so confident in its ability to help people and change their lives that I know they'll probably change their mind once it's on. And so we have a vast array of fitting sets just like this here at the office, which have 12 to 40 lenses in them with different diameters and curvatures for everybody's specific eye. And so what we do is we measure the specific peaks and valleys of all of our patients' eyes when we fit them with contact lenses with a device called a topographer. And a topographer is a very specialized piece of equipment which will actually measure to the millimeter the height and peaks and valleys of somebody's eye, their cornea. And that lets us fit the contact lens specifically for their eye. So we did that with Mark. We also measured the thickness of his corneas, and this is also standard with all of our patients who are fitting with these lenses, because we want to make sure that as we treat them with this lens that their cornea is not thinning over time, that we don't need to do something else to intercede. So that's something we do. And we also take photos of the eye and the curvature of the eye with a camera that's mounted to our what we call a slit lamp, which is the microscope we use to look at people's eye. So this whole process probably takes about 30 minutes the first time, 30 minutes to an hour. And really I say, you know, this is a process, this is a journey, and I will be as patient with you as you are with me, and we'll get there. We'll get there, but you got to be patient with me, and we'll get there, and you'll hopefully be very happy with the end result. Is that something like what I said?
Yep.
Yeah. Good.
We know how passionate Dr. Deom is, right? Yeah. So, Mark, when Dr. Deom put that first lens, that trial lens on your eye in the office, what happened?
I could notice a big difference in it, yeah.
You could see?
Uh-huh.
Was it comfortable?
Yes, right from the start, yeah.
Okay.
Mark was one of those cases where we immediately noticed almost a 5 to 6 times improvement with his vision. That's many, many lines of vision. That's going from non-legal driving to legal driving in his eye, in his one eye. He has keratoconus much worse in one eye than the other, which is very common for people with keratoconus to have it sort of asymmetric. But yeah, it was a pretty cool experience. So then what we do is we actually get the lens, because the lenses we have here are for size and fit, and then we order the prescription in the lens, and that takes about a week. The company we work with, although they're on the other side of the country, is very quick in getting them here, and we can get them within a week or less sometimes, and we give them to the patient, put them on, and you know, that's what makes it all worth it. When we put it on, they could see with just the lenses on. And a lot of times what I'll do is I'll have the patient leave the room and come outside and just look around and just be like, you know, and I just like to watch them, watch their face when that happens, to see, you know, what their feelings are, what their emotions are, because it's really a life-changing type of therapy.
And Mark, do you have them in both eyes?
Mm-hmm.
Okay. So when Dr. Deom brought you out and you were looking around, what did you think?
There were tears coming out of my eyes. Yeah, it was a big difference.
And how are you now, like driving, watching TV?
Everything is good. I drive at night, no problems.
No glare, no halos.
Mm-mm.
And talk to us about the comfort of the lenses.
Comfort of the lens. You don't even know you have it in. That's how comfortable it is.
And putting in, taking out, you'll be able to do it no problem?
No problem. Just at the beginning, it might be a little tricky to put in, but
And I think with any of us, whether it be a soft lens or hard lens, it takes a little bit learning how to put it in, take it out.
Absolutely, and I think, you know, and that's why I always say, let me do it the first time, and let me put it on your eye, because I don't want them to get frustrated with that initial putting it in. Let me do it. I can do it very quickly and efficiently without having any issues, so I can get it in there in about 2 seconds. It's on the eye, they feel it's comfortable, they see it's clear, and then they know what they're working for. I think whenever we have something we know is going to benefit us, it makes that process, anything worthwhile, it might be a little tough. You know, I think somebody said that, and I think it's so true.
And Mark, you had mentioned before that you were on the Keratoconus website. What would you say out there to our viewers, maybe someone's watching who has keratoconus, about these lenses? What would be your advice to them?
I'd tell them to come and see Dr. Deom. He's the only person around here that does it. Come and see him and he'll fit you up.
And your experience with the staff and everything was good?
Everybody's very friendly and helpful, yeah.
Good, good. Dr. Deom, anything in wrapping up about keratoconus?
Yeah, you know, one other thing I just want to mention is that, of course, these lenses are perfect for keratoconus, but there's so many more applications for this particular lens. And so we could have another show with somebody with a totally different condition, and maybe we will. But just briefly, because, again, you put the solution in the lens and put it on the eye, that eye is bathed in solution all day long. So for people who have severe dryness issues, and we see a lot of those patients here at the Dry Eye Center of Northeastern Pennsylvania. That is a good treatment for them. And again, the comfort and the clarity of vision would be the same for them. For people who have all different types of corneal issues, and sometimes those people don't even know they have corneal issues, but if you are out there and have had vision issues that were unable to be corrected with glasses or contacts before, then these lenses may be for you. And I think that, you know, at least allowing us to take a peek and see if this would be an option is a great piece of advice.
And they even make now bifocal scleral lenses.
We make these lenses. The manufacturer of the lenses, again, in Oregon, great place. They're really just on the cutting edge of everything. They have a multifocal, which allows somebody to see far away and up close with these lenses. Lots of different things.
So folks, again, kind of wrapping things up here, if you're out there and you have an eye condition that maybe you're not sure what's going on, give us a call. We can answer any questions you have. If you have keratoconus, there's now treatment options out there that can help. Scleral lenses can be a great option. Dr. Deom is a leader in the field, actually does lecturing to students and other doctors about scleral lenses. So we're very fortunate to have Dr. Deom in the practice with us. Folks, we need to wrap things up here. We thank you for watching. Mark, we really appreciate you coming up and sharing your story. It's great having you. Folks, again, you're watching Eyecare today. If there's ever any questions, give us a call, 453-2020. Remember our website, www.drkislan.com. We'll see you next time on Eyecare Today.